If you needed surgery 10,000 years ago, you were awake for all of it. There was no anesthesia, no painkillers that actually worked, no understanding of infection, no sterile tools, no way to make any of it hurt less. And yet we have proof, carved directly into human bone, that people underwent major surgery anyway. Not once, not by accident, but again and again for thousands of years across almost every continent on Earth. People chose this, and some of them survived it, healed, and lived for years afterward. This is what it was actually like to be on that table. Let's start with the strangest and most terrifying procedure we have solid evidence for: a hole cut into a living human skull. It's called trepanation, and it is, almost certainly, humanity's oldest known surgery. We have skulls from as far back as 10,000 years ago, found on nearly every inhabited continent, all showing the same thing: a clean, deliberate opening cut or scraped into the bone of the head on a person who was alive when it happened. Picture what that actually meant for the person lying there. You are conscious, you are aware. Someone is pressing a sharpened stone, or a shard of obsidian, or a crude blade against your scalp, and then against your skull itself. There is no numbing. The pain of the initial cut into skin and muscle would have been immediate and blinding. And then comes the part that's almost hard to imagine: the scraping. Bone has to be worn away, bit by bit, sometimes for what researchers estimate could have taken 20 minutes to an hour, depending on the method and the thickness of the skull. Imagine holding still, being expected to hold still, while another person patiently grinds a hole through the bone protecting your brain. Why would anyone survive being still for that? The honest answer is, they may not have had a choice. Some historians believe these patients were physically restrained. Others think they may have been given something: fermented drinks, plant extracts with mild sedative properties, that dulled the edges of the experience without coming close to what we'd recognize as anesthesia today. And for some procedures, the belief in why you needed the surgery may have mattered more than the pain itself. Many researchers think trepanation was performed to release evil spirits, relieve the pressure of a head injury, or treat seizures and severe headaches that ancient people had no other way to explain. If you believed a spirit was trapped inside your skull causing your suffering, then the agony of the cutting might have felt like part of the cure, not separate from it, a price you were willing to pay to become well again. And here is the detail that changes the entire story. We can tell from the bone itself who survived. When a person dies during or shortly after the surgery, the edges of the cut stay sharp and unhealed. But when a person lives, the bone begins to remodel. Smooth, rounded, new bone growth forms around the opening as the body heals over months and years. And across the skulls we've found, a striking number show exactly that kind of healing. In some ancient burial sites, the survival rate for trepanation is estimated at safely over 50%, in a procedure performed with sharpened rock, without anesthesia, without any understanding of germs. Some skulls even show evidence of multiple separate trepanations, healed at different times on the same person. Someone endured this surgery, survived it, healed completely, and then, at some later point in their life, chose to go through it again. Now let's go somewhere different. Ancient Egypt, and one of the oldest surviving medical documents in the world. A papyrus describing surgical treatments for injuries, broken bones, dislocated joints, wounds that needed closing. Egyptian physicians didn't have anesthesia either, but they had developed something close to genuine surgical technique. They used linen for stitching wounds. They used honey, which we now know has real antibacterial properties, packed directly into open injuries, centuries before anyone understood what bacteria even were. If you were a patient having a wound sewn shut in ancient Egypt, you would feel every single pass of the needle through your skin, fully conscious while a physician worked with a steady hand, because your stillness, or your restraint by assistance, was the only thing keeping the procedure survivable at all. Move forward again, and you find something that sounds almost impossible. Successful abdominal surgery performed in ancient India, described in texts attributed to the physician Sushruta, working somewhere around 2,500 years ago. Sushruta is credited with descriptions of procedures that read like genuine surgical training. Removing bladder stones, treating hernias, even early reconstructive surgery, Rebuilding a damaged nose using skin grafted from the patient's own forehead, a technique so effective in its basic principle that plastic surgeons still use a version of it today. None of this was done under anesthesia. Patients having a stone cut out of their bladder, yet one of the most excruciating procedures imaginable, were held down by trained assistants whose entire job was simply to keep the patient's body still enough for the surgeon's hand not to slip. Think about what that division of labor tells you. An entire role existed across multiple ancient surgical traditions, dedicated purely to restraining a screaming, thrashing human being so that someone else could keep cutting. That was a real job. People trained for it. And there's a detail from ancient surgical writing across several traditions that's easy to miss. Physicians paid enormous attention to the patient's face and breathing during surgery, not out of tenderness, but because a patient in too much distress would move, and movement during an open surgery could kill them faster than the illness that brought them there in the first place. So ancient surgeons developed something close to a working relationship with pain itself. Calm voices, steady pressure. In some traditions, a physician would talk continuously to the patient throughout the entire procedure. Not comfort for its own sake, but a genuine surgical tool, a way of keeping a conscious, suffering person tethered enough to reality to stay still. By the time you reach the Middle Ages in Europe, surgery had become almost a public event. Barber surgeons, the same men who cut hair, also pulled teeth, lanced boils, and amputated limbs, worked fast because speed was the only mercy available. A skilled amputator might remove a leg in under a minute, not out of carelessness, but because every additional second was another second of unbearable, fully conscious agony for the person on the table. Patients bit down on leather straps or wooden blocks, not as some cinematic detail, but because screaming, uncontrolled jaw movement could cause a person to bite through their own tongue. Alcohol was sometimes offered beforehand, not because anyone believed it worked as true anesthesia, but because it was the only thing available that blurred the edges even slightly. And still, patients were held down, sometimes by 4 or 5 men at once, because the body's instinct to escape unbearable pain is stronger than almost any act of will. This went on, essentially unchanged in its fundamental horror, for the vast majority of human history. Anesthesia, as we understand it, reliable chemical unconsciousness during surgery, didn't exist until the 1840s with the introduction of ether, which means that for every surgery performed by every civilization before that moment, Egyptian, Indian, Greek, Roman, medieval European, and countless others, every single patient was awake. Every one of them felt it. And here's the part worth sitting with. We tend to look back at ancient medicine and see it as primitive, almost laughable. Leeches, evil spirits, crude tools. But the survival rates we're finding, the healed trepanned skulls, the described techniques for stitching and grafting and stone removal, tell a different story. These weren't reckless butchers. They were, within the brutal limits of their world, remarkably skilled. Skilled enough that a meaningful number of their patients lived, healed, and went on with their lives. The horror wasn't incompetence. The horror was simply that competence back then had nothing to offer the pain itself. We live now on the other side of one of the quietest, most enormous gifts in human history, the ability to be unconscious for our own surgeries. It's so completely ordinary today that we barely think of it as a medical miracle at all. You go to sleep, and you wake up, and the worst part is already over and you weren't there for it. For every person who has ever needed surgery in the last 180 years or so, that is the astonishing, invisible mercy that almost every human being who ever lived before them never had. Somewhere 10,000 years ago, a person lay down, fully awake, while someone else began cutting into their skull, and chose to believe it would make them well. And the bone tells us, sometimes it actually did. The next time you're wheeled into an operating room and a nurse tells you to count backward from 10, remember what that unconsciousness actually is. It's not just comfort. It's the ending of 100,000 years of a very specific, very human kind of suffering. One that for almost the entire span of our existence simply had to be endured, wide awake, one cut at a time.